If you've seen any of our other videos, you've heard me tout the fact that our help around Medicare does not cost you anything. We will help you with your Medicare or Social Security decisions at no cost, period. So the question inevitably comes up, well, how do you support your family? Or how do you make money? Or what's the catch? In this video, I'll go over how insurance agents who offer help with Medicare support their families. Now, the quick and easy answer to that question is that insurance companies that offer plans built to fill in the gaps that original Medicare does not cover pay agents a commission. Let's unpack that a little bit. If you get original Medicare only and you call us looking for help around how to sign up, what it will all cost, what to watch out for, or anything related to original Medicare only, we will help, and we are happy to help. It is a complicated process, and going through it for your first time can be intimidating. Use us or other agents around the country who've done it more than once, and it'll be much less intimidating. It's important to know that we will not get paid for anything connected to original Medicare, period. Now, if you've seen our other videos, you'll know that there are holes that original Medicare just does not cover, and for those who choose to get original Medicare only, they are exposed to quite a bit of risk. Most people choose between two different paths to fill in those holes. The first is keeping original Medicare and adding a supplement plan. The second is a Medicare Advantage plan, and I'll talk about each of those individually. We have lots of videos around what these plans are and how they work. This is not that video. This video is just about how they relate to commissions. With all of the plans that we will talk about, it's important to understand that you will not pay more for these plans by using an agent. The costs that you may have will be the same, even if you decide to bypass an agent and go directly to the insurance company. A commission is built into the monthly premiums, and if you don't use an agent, the insurance company keeps that commission that goes to their overall profitability. It doesn't get passed back to you as savings. Now, with commissions, I'll be using the words initial year and renewal years. Most plan commissions are built to have a higher amount for the initial year that someone starts Medicare and first goes on one of these plans, and then there's a lower renewal amount for subsequent years or switching plans after they've been on Medicare. All right, let's talk about the supplement plan path first. If an agent helps you get on a supplement plan, the insurance company offering that supplement plan will pay the agent a commission. Supplement plans are tricky to get into details because how much that they pay depends on a lot of different factors. Every insurance company can set their own amounts, and they can set how long they will continue to offer commissions. Some may offer agents a commission for as long as you stay on the plan. Many have an initial year commission and then lower renewal amounts for subsequent years that taper down and eventually end over a certain amount of time. I like to be overly specific in these videos, but supplement plan commissions aren't regulated like the others that we are going to talk about, and they're kind of all over the place. Now, for those who go the supplement plan route, many choose to get a Part D prescription drug plan as well because supplement plans do not cover prescription drugs. If an agent helps you get a prescription drug plan, there's a small commission connected to those as well. Again, these vary a lot and are dependent on the insurance company, but know that unlike supplement plans, the federal government actually regulates a maximum commission allowed for Part D plans. The reality of Part D is that they typically require the highest service burden of any of the plans in this video because new drugs are coming out all of the time, plans are changing how they cover drugs every year, and insurance companies often add or eliminate plans each year. So there's a lot of agents out there who choose not to help with Part D because the commissions are so low for how much time goes into them. By low, I mean some plans do not pay a commission, and the maximum commission is $92 for the initial year and $46 for renewal years. Please let me be clear, this is not a knock in any way, shape, or form for agents that choose not to help with Part D. It can be a nightmare to handle, and if someone finds that the economics of helping with Part D will hurt their business, we completely understand that decision. If you have an agent that does not help with Part D, they will likely direct you to Medicare.gov, which is a good place to go if you want or need to self-serve around Part D plans. All right, a couple of other things to clean up with supplement plans, and then we'll go over the other path. Supplement plans do not include dental, vision, or hearing coverage. Most agents can help you get standalone dental, vision, and hearing plans, and the agent helping you with these will get a commission for those plans. Again, the commissions are small, similar to or even less than Part D commissions, but these plans typically have a much lower service requirement around them compared to Part D. These other plans are referred to as ancillary plans. They are add-ons that some choose to get while others choose not to. All of these plans are optional, by the way. Dental, vision, and hearing are just picked less frequently than, say, a combination of a supplement plan and a Part D plan. All right, so in general, agents that offer supplement plans are seeing commissions on the supplement plan itself, Part D drug plans if they offer help with those, dental, vision, and hearing plans. Also, in general, agents who offer only supplement plans have a lower service requirement, especially if they aren't offering Part D help. Supplement plans are standardized and they don't really change. The way supplement plans are built means that there are fewer coverage variables as compared to Advantage plans as an example. The only real consistent service issue on an annual basis would be the premium increases that can come with supplement plans. Other than that, supplement plans are pretty straightforward. Again, I need to be clear, this is not a knock on agents who choose this route. There are certain parts of the country where a supplement plan is the only available option. For an agent to offer supplement plans, that agent is not required to go through the same training and certifications as they would to offer Advantage plans, which I'll get to here in a minute. Finally, somewhat connected to that, in general, not always, but in general, supplement plan commissions are less than Advantage plans. All right, we've been hinting at this. Now let's talk about that second route that most people take to cover the gaps of original Medicare, and that is a Medicare Advantage plan. And I just realized that I said most people. I don't mean most people choose an Advantage plan. I mean most people choose between a supplement and an Advantage plan. All right, Advantage plans replace original Medicare, and they include hospital and medical coverage. They often include prescription drug coverage, dental, and hearing in some form, and they can include other things like gym memberships or other services. So Advantage plan commissions are not a little from one plan plus a little from another. The Advantage plan commissions are all in one number. Now, different from supplement plans, Advantage plan commissions are regulated and set by the federal government. There are a handful of states that fall outside of this general rule, but for the vast majority of states, the maximum commission for the first year somebody initially goes on Medicare and then chooses an Advantage plan is $601. Every year after that, the renewal is $301. These numbers are for 2023. This is public information. You can find it on the CMS website. It's not a big secret. Each year, the federal government adjusts these numbers. The way the agent and the agency world works is that the commission amount doesn't always go 100% to the agent. There's often a split of some sort with the agent and the larger agency that the agent works with, or any number of different arrangements that could happen with this. This is true of supplement plans as well, by the way. With Advantage plans, the other relatively common commissionable plans that come up are the hospital indemnity plans and the cancer plans. We have a couple of videos on these plans, but basically they exist to help mitigate the cost risk of inpatient hospital stays and cancer that can contribute to hitting an out-of-pocket maximum if you have an Advantage plan. These will have commissions connected to them as well, but they vary again by insurance company, the type you get, and where you live. Okay, I think that about covers the commissionable plans we deal with most often on the Medicare side. Now, I mentioned that supplement plan route commissions are typically less than Advantage plan commissions. This really is difficult to put real numbers to because they vary so much by insurance company and area of the country. There are some supplement plans that are right up there with Advantage plan commissions, especially when you add in Part D plans, dental, vision, and others. But in our area, which is the Intermountain West, that is the exception, not the rule. Advantage plans typically have higher commissions connected with them. Now, the last thing to highlight here, if an agent is pushing one plan over another based solely off of commissions, this is not a recommended business strategy, in our opinion. Our agency has been around for a long time. We plan to be around for a long time. Our long-term strategy is to do what's best for you and our clients, because if you are happy with our service and the plans that you picked, you will refer your friends and family for years to come. Pushing plans that are not in your best interest is a horrible long-term strategy. There are many, many agencies and agents that share this same philosophy, including any 90 days from retirement partner that we work with. All right, hopefully that helps answer the question around how agents support their family while offering a no-cost service to you. I like to be overly specific in these videos, but this one just has so much variability in geography and companies that I can't really give exact numbers other than the federally regulated numbers of Advantage plans and Part D plans. Be sure to check out our other videos that go into more detail around how Advantage and supplement plans actually work. If this was helpful, consider giving this video a like, maybe subscribing to this channel. Thank you for making it this far, and I will see you in the next video.